Good morning, everybody. Today, I want to talk about one good topic that I like so much because you can talk about the psychological part of the disease and the one stage of the patient. For example, today I talk about the physical care for a patient who is terminally ill. For example, in this case, I want to talk about what you can do for providing more comfort for the patient. This can be used for doctors, in another case for patient when it's about psychological part of the patient. The doctors can help the patient in this case because the way you treat the patient or the administration of any drugs can help so much the patient and what you can convert the religion, family, uh, empathy of the family and of the doctors can help so much the patient. And for example, for physical care for terminally ill people, in this case, if there is physical pain, it's so important the doctor have one history of the administration of the medicine for the patient. Because, for example, having any disease is so hard. For example, we decrease the pain of the patient. Any medicine doesn't work and another work. And in this case, if you have one history, we can know the effects of the patient. You can show, you can see through the patient reaction for this administration. For example, if the medicine that doesn't work, you can provide another medicine for work more well in the patient. And another case have any symptoms, for example, in the terminally you can help the patient if your administration medicine. For example, nausea and vomit. If you do one observation during the we follow the patient and they ask you what he feel or you see his reaction. This is, for example, so common in cancer, for example, chemotherapy or another ways of treatment of cancer. The patient have a lot the nausea and vomit. And if, for example, you do not force the patient, it is so important because in case only the smell of the food can do the patient feel so bad because the administration of medicine for pain in another case, in this case, the patient feels so weakness because lost weight, did not eat correctly, lost a lot of nutrients because the disease or the effects of one serious disease. Another case is so common is the diarrhea because in terminally ill patient, for example, in this case, one solution is eating meals, several meals during the day for increase the force of the body. But having any types of food that can cause it is because it's so good to have one good nutrition for care of the patient and the physical appearance. Because, for example, if one person is terminal illness, the patient look more weak and times lost the hair. And if, for example, one patient have so much care about the patient and see your body so fragile, and he feels so bad. For example, in case of a woman when lost the weight, lost hair, you can provide any, for example, any help how do the hair or buy any types of hair for you put on the head for the patient feel more good. Another case is so common constipation. Constipation, you need to increase the nutrition of the patient, give him more good food, vitamins for decrease it of this a little bit of this for you have the increase your health. And then another case can help is regular exercise, any time for physiotherapy. Any patient have a lack of appetite and is chewing difficulty. For example, again, you need to consult of nutritionist because can help this. For example, do any types of food that can increase or promote the appetite in the patient, and it is helping in another symptoms too. Another is so important in this case is the psychological support for the patient. Because, for example, have a lot of religion, have another cultures, have another type of reaction of this case. And if you have a family, you have a professional can give good support for the patient. For example, you can ask for the patient what he feel, hear the patient, because in a lot kind, another kind of the patient, for example, any like be more silent, another like talk about this, another like have anyone for talk, and you can give for the patient in one comforting in the last time of your life, give for example attention, give care, and another thing. For example, a lot of cases of this, for example, give the patient depression, this station during the patient have depression, and the depression is one so deep psychological problem in the society, and in the case of the patient in terminal ill. Uh, you can, for example, do any activity for distraction the environment, give one specialist how psychiatry for talk with this patient, and if you, for example, this patient have a family, you can talk with the family, explain, see what the best way or for good ways for the family action, talk with the patient in this case. And for example, another so good thing is religion, spiritual support, because in a lot of cultures, in a lot of religion have any support for when the life finish, and this in times helps so much the patient and give you one comfort for your heart philosophy way of you say it, of course. And another way is, for example, the acceptance, permission, and the lovingness having with the disease. For example, stay socially active can be beneficial even more so when the patient chooses to continue with their daily activity. For example, encourage the patient have the quality of time. For example, when the science and the doctor cannot help more the patient, you can encourage the patient to spend his last time of life with he like have any person like travel, have another person like he stay at home and have common life, talk with the family, live the last time of life with the son, daughter, grandmother, grandfather, father, and mother. And in this case, have one good environment is so good for the patient. And they have a lot desire of terminally you. I see case of, for example, the patient who want they have see the merit of the son, daughter, and they want to go for one place he always want to go, and they just can give, for example, the last time of life be more comfortable. For me is all for today. Thanks for your attention and see you in next video.